Hey there, my name is Ryan Fan, and I'm the clinical director here at Reform Prosthetics of Savannah. I wanted to take this time to discuss a topic of moisture management, which is very important in the hot temperature and summer days, especially here in Savannah, Georgia, where it's very humid. The issues that arise are the moisture levels increase so much to where the residual limb can become macerated, and the shear forces of walking can create blisters that could lead to infection and other issues that we certainly want to avoid. So there are a few things that you can do to remedy these issues, such as remove your prosthesis and gel liner every 4 to 6 hours to inspect your residual limb and dry it off. You could also utilize high-powered antiperspirants such as Arid Extra Dry and Certain Dry. These are topical ointments that you can buy over the counter, and these will be applied at nighttime as instructed by the manufacturer. Another option would be certain powders that would absorb the moisture, and although effective, they leave a pretty nasty residue in the liner, so most patients don't prefer to use this, but it can be useful. A more effective way, from my experience as a clinician, to manage moisture would be utilizing some sort of a wicking sock beneath your gel liner. That can be in the form of a Swift Wick sock, which I find to be the most effective. However, there are some people that their skin just doesn't agree with the fabric. So if this is not skin friendly enough for your patient, then I would consider a liner sock. So it's more skin friendly and does have the ability to manage moisture. Durability is not as good, so you may have to have more of them. And the most skin friendly option would be a nylon sheath. It's not as effective at moisture management, but it's better than not having it. Comfort, they make a silver sheath that is very effective compared to the white sheath, and it's a little more skin friendly. So I would consider that as well. And the last option would be some new technology that's coming out that personally I can't speak to the efficacy of it, but they are available, so you could discuss this with your practitioner. Willowwood has the Smart Temp Liner, and basically the technology allows for the gel to absorb your heat, and it has a gas tank. So once it fills up, then it can no longer absorb heat anymore, and then it just functions as a normal gel liner, but it can reduce the heat retention. And then Endolite or Blanchford, they have a liner that has perforations that's supposed to allow your sweat to flow out of the liner, and Uniprox also makes a liner such as that. Again, I don't know how effective the new technology and the gel liners are, but they are available, and I would definitely speak to your treating practitioner if you want to inquire about trying it. That's all I have today as far as moisture management. I hope this has been helpful, and I would encourage you to speak to your practitioner before trying to implement any of these methods of intervention, just to make sure it's going to be appropriate for your diagnosis and your prosthesis design. Thank you.